Today I am going to present Approach to a Patient with Leg Ulcers, created by Yara. We always start by thinking of all the possible causes for this symptom and categorizing differential diagnoses in our mind. You can categorize them using surgical filter, but the most common causes are venous, arterial, and neuropathic ulcer. Some happen for edema, weeping, skin tears from falls, and pressure ulcers. Other rare ulcers are TB, pyoderma gangrenosum, syphilis, arteriovenous fistula, rheumatoid arthritis, SCC, and sickle cell disease. With careful history and clinical findings, such as pulses, sensation, colour, capillary refill from examining our patient, we can then narrow down the causes of ulcers and start management. If it is painless or slowly progressive sensory loss, it's more likely to be a neuropathic ulcer. However, arterial, venous, and neuropathic can be painful. Then we look at arterial pulses. If there is no pulse, it could be ischemic leg ulcer. We can have a more targeted approach when taking a history. That is, not just asking questions from a template, but actually using open and closed questions to give us the information for arterial pain, such as intermittent claudication, rest pain, or pain that's more severe at night. But do not forget, it can also be a mixed arterial and venous ulcer, or arterial disease with associated neuropathic ulcer, or an atypical ulcer. So it is worth to keep on looking at other defining criteria like sensation. Painless with reduced sensation can narrow down the diagnosis more towards neuropathic ulcers. Absent or reduced reflexes can further confirm the neuropathic ulcer. The surrounding skin colour in different ulcers can be seen on the table later. We must also look at capillary refill. In history, it is very important to ask risk factors for arterial disease, such as smoking, diabetes, hypertension, cholesterol, previous heart disease, stroke, and family history. Any risk for venous ulcers, such as deep vein reflux, and any risk for neuropathic ulcers, such as diabetes, SLE, hypothyroidism, vitamin B12 deficiency, alcohol, and toxins. Like every swelling or ulcer, we look at the site, size, shape, surrounding skin, and temperature to differentiate between these three ulcers. Look specifically for chronic venous insufficiency signs, such as lipodermatosclerosis, hemosiderin pigmentation, edema, and stasis dermatitis. Look for specific features of arterial disease, such as necrotic eschar, prolonged capillary refill, shiny atrophic skin, and loss of hair. Neuropathic ulcers can be seen as the damage over pressure areas, heel or perhaps underneath metatarsal heads, regular outline following the skin contour, or thick calluses surrounding the ulcer. Feel free to pause this video and take a moment to process. A well-taken history with good differentials will be vital to guide the necessary investigations for diagnosis. When you take the history, you must include three things: causes of the symptom, details of the symptom itself, and effect of the symptom to your patient. It is very important to know the causes of ulcer. Presence of arterial ulcers is one of the criteria for critical limb ischemia, defined by the European Working Group, and needs intervention, so we should not miss it. If you treat arterial ulcer with a compression bandage, it will make the ulcer worse. It is therefore very important to measure ABPI, ankle brachial pressure index, in a mixed arterial and venous ulcer. Only if ABPI is more than 0.8, we can diagnose as venous ulcer, and compression bandaging can be used. What I would like to highlight here is that I do not recommend you to memorize these concept maps. Instead, we hope that through these concept maps, you will learn the process of diagnostic reasoning. Understanding the diagnostic thought process is useful for all those who wish to learn the art of clinical diagnosis. The ability to critically examine a list of differentials, rank them according to likelihood, and pick up what does not fit is very important. Using these examples, read some symptoms to diagnosis books to create your own one. Thank you very much for listening.